Namaskar and welcome to the 146th episode of Gyan Pravah, a podcast series started by none other than our beloved President Fogsi, Dr. Sunita Tandulwadkar. Dr. Tandulwadkar is a perfect blend of intelligence, hard work, discipline, and tremendous integrity towards our parent organization, Foxy. Madam's hard work has put Foxy on the international map, and I'm so happy to share that we are from the same city, and so Pune is very, very proud of you, madam. Over to you for your words.
Thank you, Charu. Thank you. And welcome, Dr. Prashant Gangal, sir. It's always honor and pleasure to have a personalities like you on a Foxy platform. Charu, thank you for having him so that it's awareness about the breastfeeding, breast milk. Everything is so important. It looks small or probably it is a neglected field, which probably with the efforts of Charu bringing breast awareness, amazing work she has done in this committee. This is your third year, right, Charu?
Yes, madam, yes.
Yeah. And I think looking back, you will feel very proud that you have worked very hard to bring this committee. It became very popular with your work. Thank you, Charu. Thank you for having Dr. Gangal with us. Thank you.
Thank you so much, Sunita madam. It is indeed, our proud privilege to host these podcasts. It is your brain and your idea. Because of it, so many national and internationally recognized faculties are a part of this podcast series. So, Breastfeeding, Transforming Ideas into Action is the name of our podcast series for today. And we have none other than Dr. Prashant Gangal, a noted pediatrician who has done revolutionary work in the field of breastfeeding. Sir, your introduction is beyond amazing. Introducing the concept of the Malishwali Bai as somebody who will promote lactation, the 4Ds clinic, the point of training more than 20,000 students for breastfeeding and lactation, and your role in BPNI and for promoting the baby friendly hospital initiative is mind blowing. I think we couldn't have had a better proponent for breastfeeding than you today, sir. Thank you so much for your presence today, and we are really happy to welcome you for the Gyan Pravah podcast series.
Thank you. Sir,
Thank you.
our pattern is you and Charu will be in the frame, and I'll join the viewers link to listen to you all. Thank you and enjoy this podcast series.
Before you leave, madam, I would like to say that I am obliged to Gyan Pravah, Foxy, you both, Dr. Tandulwadkar and Dr. Charu Pape, for offering this opportunity to reach out to so many people for advocacy of breastfeeding.
That's
And
very
I
important.
wish that this particular podcast helps many to inculcate few things which we would be discussing.
Absolutely. Enjoy, Charu.
Thank you
Enjoy
so much.
your
Thank you so
time.
much, madam. Thank you. And now over to you, Gangal sir. So you are basically a pediatrician, and most pediatricians are so busy attending calls of obstetricians and doing their immunization in their day-to-day OPDs. How did you move over to the field of breastfeeding?
In 1989, after I passed my MD in pediatrics, I was planning to start practice. And that was the time I came in contact with three great advocates of breastfeeding, Dr. N.D. Kumta, Dr. G.S. Hathi, and Dr. R.K. Anand. They are the real pioneers of breastfeeding promotion in India. And along with them, I had opportunity to organize a workshop at Devlali where an international expert had come, Dr. Felicity Savage, who was training stalwart pediatricians and neonatologists and obstetricians all over the country and many other countries. And that is where I got trained. That is where I got motivated.
Okay.
And subsequently, when I started my practice and I started working with maternity homes, of course, as a pediatrician and neonatologist, uh, guiding mothers, supporting mothers for breastfeeding is a part of my job. But I thought that I was not adequately prepared for it, not theoretically, but practically. And when we started promoting these concepts of exclusive breastfeeding after birthing and for first 6 months, I thought that the mothers were not really prepared or it was rather our fault that we are not preparing them for breastfeeding. And that is the time with the zest of motivating these mothers that I started getting more knowledge and I thought of improving this particular field. And that is how I got involved. And then there was no looking back after that. And I thought that somebody becomes a cardiologist, pediatric cardiologist, somebody becomes a pediatric nephrologist, some super specialization. So for me, from 1990 onwards, for last 35 years, this has been a super specialization. But apart from my practice, I devote time for this activity, and I'm thoroughly enjoying it.
So it was a path-breaking field that you took up, and the people who tread these paths initially, or who are the first ones, they have to face a number of hurdles. But because of your efforts, sir, today, I think we have made a small change in this entire concept of breastfeeding, and Foxy has taken it ahead along with your help. And we have a committee which supports breastfeeding, and I have the fortune of heading this particular committee of breastfeeding and puerperium. So thank you so much for that, sir. So one thing that I keep wondering always is that breastfeeding has been talked about in India right since mythology. Since the times or ancient times of Krishna and Ram, there is talk about how the mother breastfeeds, or how Putana tried to breastfeed Krishna and tried to kill him. So breastfeeding is such a natural instinct, and it should have just be a part of every woman's life. Like, why do we need to train or teach somebody for breastfeeding is the question I keep thinking to myself. And I thought that you're probably the right person to ask this question to. And I'm sure I'm going to get an answer from you for this, Dr.
It's a
Gangal.
very nice question. Though breastfeeding is a natural behavior, it is also a learned behavior, mimicking behavior, you can say. I will tell you about the experiment which was carried out by scientists about learning the behavior of gorillas in breastfeeding. They found that the gorillas who were brought into captivity at adolescence from the jungles were able to feed their babies much better than the gorillas who were brought in very early in life. The gorillas who fed well and who were brought into cage or whatever captivity at adolescence as young child, they had seen other gorillas feeding, and that is why they had learned how to feed their babies. And whereas the gorillas were brought very early in life, they had never seen another gorilla feeding. And same is the case with human beings. Till about 200 years back or 150 years back, the birthing used to occur in the house, a big house where three generations of families used to stay. And there are multiple births occurring in that family. And birthing was not something which was occurring in the hospital or maternity home. It was occurring at home in the company of the loved ones,
Yes.
dadi, nani, mami, masi. And as the children grew up, they could see the baby care, breastfeeding was part of their entire house, and it was something very natural. So young children, whether boy or girl, would learn, see breastfeeding and know it as a natural norm. Now, what has happened for last 100 and 150 years is that we have got birthing into hospitals or maternity homes. So the first thing that mother starts feeling that she is a patient, number one. Number two, you will be surprised to know that 80 to 90% of first time mothers have never seen the other mother's breastfeeding. Because there are nuclear families now in the town. So that is a problem they are facing. And another problem is that though it has become medicalized, it is not taught in schools or colleges. So the learning places which are there for the moms have been destroyed because there is no more joint family with a big house and a room devoted for birthing and breastfeeding and baby care. And the schools and colleges have not picked up the clue and started training whether medical or non-medical. If you take the medical curriculum, still it is not adequate to train the young doctors to help a mothers to support breastfeeding. So due to breakage of all this system, plus there has been a lot of migration from the villages to the towns. Mothers have got jobs in the industries and factories, so they have to leave their babies home. So what will they feed the baby? They might well leave the baby back home at 6 weeks, 10 weeks, 14 weeks, 20 weeks, whatever. And then the availability of formula milk and maybe the digital media also helping the mothers to say, okay, your breastfeeding is the best. But if you can't feed, we have these ready-made solutions for you. So all this had an impact on the breastfeeding behavior in last 50 to 100 years. And that is the reason we need to talk about breastfeeding because it is like you see the story of gorillas, it's the same. So we need to teach the mother. So it's a natural behavior, but a learned behavior, a mimicking behavior onto the limbic system.
Right. So well said, sir. Thank you so much for that input. And so, when I remember as a teenager, I used to hear these stories about the room in which the woman used to deliver, and she used to be kept over there for close to 6 weeks, and she barely had any contact with the outside world. And I used to think that very cruel at that time, believe me. But today, when I look back, it makes so much sense because there the woman, as you rightly said, was concentrating totally on her baby. She's to only breastfeed, eat, and rest, which is exactly what she should be doing during the puerperium, and not scrolling her mobile or talking on the phone with friends or interacting with the hundreds of guests who come to see the baby, because that is going to disturb the entire link. And just probably these are also barriers to breastfeeding, probably. So I think a right midway path wherein the mother and the baby are exclusively with each other, and only the close and loved ones surrounding her at that time should go a long way. And the second point which you mentioned about adolescents, I think when they are being taught about the birds and the bees in school nowadays, they have these sex education lessons right since third and fourth standard, probably this new point should also be introduced. And we're happy to share that we have an adolescent committee also of Foxy, which deals with breast health. But probably we don't talk about lactation and breastfeeding. And maybe in a slow and proper manner, we should be introducing these thoughts also to our youngsters. So thank you for those take home messages. They were really wonderful.
A
And
few anecdotes about what you are saying about mobile and everything. I'm
yeah,
still attached to a maternity home, so I attend birthing and also I attend to mothers after delivery. And the message I convey to them is that मोबाइल को जितना पास में रखते हो उतना बच्चे को पास में रखो. मोबाइल से जितना प्यार करते हो
wow,
उतना कम से कम बच्चे के साथ करो तो बच्चे को जस्टिस मिल जाएगा. फिर मैं ये बोलता हूँ कि आपको अच्छी माँ बनना है तो आपको पहले अच्छी बंदरिया बनना पड़ेगा. तो
अच्छा,
और बंदरिया जैसे अपने बच्चे को पास में पकड़ के रखती है, ना उसके हस्बैंड को देती है ना या उसकी सास को देती है. और अगर
वाह,
देना, अगर मांगती है, कोई मांगता है उसके पास से बच्चा तो वो क्या करेगी. So similarly, mothers
वाह,
should have that particular feeling
वाह,
and that skin to skin touch should be giving. I
वाह,
also tell them that आपका जॉब तो बंदरिया से आसान है. बंदरिया को बच्चे को पास में पकड़ के एक पेड़ से दूसरे पेड़ की ओर जंप मारना है, और आपको तो एक बेड से दूसरे बेड के ऊपर भी जंप नहीं मारना है. तो
वाह,
आप बच्चों को जरूर पास में पकड़ सकते हो. और जो अलग रूम आपने बोला था उसका फायदा क्या था मैं आपको बताता हूँ.
जी,
एक तो रिश्तेदार नहीं आते थे. अपने यहाँ एक कस्टम है कि जहाँ पे जैसे डेथ होता है वो तभी बाद 10 दिन कोई वहां पे नहीं जाता है. वैसे ही मेरे ख्याल से जहाँ डिलीवरी होती है वो घर में कोई 10 दिन जाता नहीं था.
जी,
तो गेस्ट ने ट्रबल करना, इन्फेक्शन कैरी करना ये पॉसिबल नहीं होता था.
वाह,
जो भी मैं मदर को प्रसूति में मार्गदर्शन लेता हूँ तभी ये बोलता हूँ कि आप इमेजिन कीजिए, आप 10,000 साल पीछे जाइए. जब भी कपड़े भी नहीं थे,
जी,
मानव जाति के कपड़े ढूंढ नहीं लिए थे तभी तक. और बच्चा होता है तो माँ क्या करती रहेगी. आपको लगता है कि बाहर घूमती रहेगी बच्चे को लेके? बिल्कुल नहीं. कहीं गुफा के अंदर शी मस्ट बी सिटिंग डीप इनसाइड द केव. And that time the Reliance Power and Tata Power were not there to give the electricity and light. So imagine in the darkness of even during the day, forget at night, where she would keep the baby. She would not keep the baby down because all
right,
insects would attack the baby, including rodents like cat, rat, and animals will also attack. So she
right,
had no option but to hold the baby close like a kangaroo and
right,
manage the baby on the chest till the time the baby could walk and face the hazards of the external surroundings. So
wow,
all that helped the mother to develop contact and proximity with the baby so that breastfeeding was successful. See, breastfeeding is the second stage. But developing bonding, developing love, that skin to skin touch, and skin is the most developed organ of the baby's body at birth. So
wow,
giving that skin to skin is so very important, as you rightly said. And that old house was really a blessing. The mothers, when I take antenatal session, I ask them, "Are you patients?" So half of them say yes, half of them say no. Then I say, "Is birthing is pregnancy a disease?" Then they say no. So are you patient? No. Then all of them will first say. Secondly, I ask them that who is going to conduct your delivery? You yourself, or doctor and nurses, or you and doctor team together? So she said, "Nahi, doctor and me together." Okay, I said nobody is sitting inside you or above you will be able to, outside you will be able to manage your delivery. You have to deliver yourself. So that
Well,
is a very important message
well,
that mother has to deliver herself. Otherwise, like Star Trek, I find mothers sleeping on the delivery table, looking at the doctor and saying, deliver. तो डॉक्टर कहाँ से भाई डिलीवर करेगा आपको? आपको तो खुद को डिलीवर करना है. तो ये कॉन्फिडेंस माओ में देना बहुत जरूरी है कि भाई
well,
वो पेशेंट्स नहीं है और उनको खुद को डॉक्टर है सिर्फ मदद करने के लिए उनको.
right,
और अगर
right.
अगर सही रास्ते से नहीं होने वाली डिलीवरी तो वैक्यूम का इस्तेमाल, फोर्सेप का इस्तेमाल या सिजेरियन.
Very well said, sir. That is a fantastically interesting conversation. And I'm going to make sure that I circulate this podcast to all my patients who are pregnant currently, and they will really love these tips that you have given them, sir. So there are so many advantages of breastfeeding. It is the first vaccine of the baby, and it prevents the child from so many problems. And one more very important advantage that has been stated regarding breast milk is that it increases the IQ of babies. And we hear that all women today want super intelligent and superstar babies, or who are good at everything. And we tell them that, yeah, you must breastfeed your baby because then the IQ will also increase. So how can IQ really increase? Is it true, or is it just a myth which you tell women so that they at least try to breastfeed better?
I tell the mothers in a very simple way. हाँ, जो बाहर का दूध या पाउडर का दूध, many mothers feel that outside milk is the tinned milk is
Hmm.
produced in factories. So I think tinned milk is not produced in factories. It is made from cows or buffalo's milk by removing water, and a
Hmm.
powder is given to you, to which you again add water to make it into a milk. So whether tinned milk or animal milk is made by a buffalo of 1,500 kg or a cow of 1,000 kg for a 60 to 100 kg calf. So
Correct.
obviously, every animal has different kind of milk because
Yeah.
that is suitable for that particular species. Okay, what is human? How human beings are different from other animals? Because of their brain, because of their intelligence. So
True.
what mother's milk contains is all the chemicals which are necessary to make that baby intelligent. And as
Wow.
you rightly said, in today's competition, whether it's NEET or whether it's IIT JEE exam, even one mark can push you back by 300 to 400 ranks.
True.
So it is very important to give exclusive breastfeeding for first 6 months and continued breastfeeding along with food till the end of the second birthday. And between second birthday to fifth birthday, like a tonic, not for nutrition. So
Well,
that advantage to the mother also, like reduced chances of breast cancer,
yes.
reduced illnesses. So like a tonic between 2 and 5 years. So that timetable has to get fixed in mother's brain. So how does the intelligence come? The
Hmm.
intelligence comes, and again, one more important fact we have to remember that brain growth is maximum in first 1,000 days. What do you mean by first 1,000 days? From conception till second birthday, it's about 1,000 days. So
Right.
at the end of second birthday or on second birthday, 75% of child's brain is already grown. 50% of height is done, but weight is only 20%. So
Acha.
if the nutrition is not properly given, what suffers maximally is brain and intelligence. So that every mother has to remember. The height suffers next, and last is weight. So we have to look at these particular advantages. And how does breast milk increase? Is because of chemicals in breast milk that a 60% increase in IQ occurs, and 40% is because of touch. So again, I said that touch is very important. Somebody holding the baby, somebody talking lovingly to the baby. So breastfeeding is not just an act of nutrition. It is also an act of interacting with the brain, interacting with the baby, and allowing the brain to grow. So that is how breast milk helps in improving the intelligence. So गाय का दूध गाय के बच्चे के लिए, भैंस का दूध भैंस के बच्चे के लिए. मैं हमेशा ये कहता हूँ, आप बाहर का दूध देंगे तो दिमाग तो जरूर बढ़ेगा, लेकिन उसका दिमाग अगर भैंस जैसा हो जाएगा तो क्या करेंगे आप? तो इसलिए आपको आपका ही दूध पिलाना है ताकि बच्चे का दिमाग अच्छा हो, फ्यूचर में अच्छा एक इंसान बने और एक अच्छी तरह से उसके मार्क्स मिले तो करियर में भी इम्प्रूव हो जाए.
Wow, wow. Such a fantastic thought. And I think this is a very beautiful take-home message for everybody, because all of us try to find the easy way out. that let us give some top milk doesn't matter. But Dr. Gangal, this is one thing I really need to ask you. And I think most obstetricians will also want to ask you that, yes, we also want to support breastfeeding. We also want to make sure that our mothers breastfeed their babies right from the golden hour, which is the first hour after delivery. But I too sincerely feel sometimes that the mother is firstly tired, exhausted, and there are barely any secretions initially. And sometimes I feel, am I just forcing her, to do something? And would it really be too much of a pup to give her that little bit of top milk in the initial few days at least? Once the letdown is there and once everything has occurred, then there is no turning back. That is fine. But initial few days, I think sometimes I really wonder whether I'm pushing my girl too hard to breastfeed, and whether I should be a little lenient with her and allow her a few top feeds, kind of.
So the answer is very simple that the first challenge of a baby in this outside world is not food.
Mm-hmm.
भगवान ने उसको डब्बा दे के भेजा है सफिशिएंट. उसको
अच्छा.
मालूम है 2-3 दिन उसको कम दूध मिलने वाला है माँ से. So that is not a challenge. The baby challenge is to survive against the infections or the bacteria which are lurking around in his environment.
Okay.
So that is the first challenge. Second challenge is temperature. So giving skin to skin contact during breastfeeding, or our forefathers were very intelligent. What they had done was they invented sari, where
Ah.
the abdomen is kept, upper abdomen is kept open so that mother can give touch to the baby while breastfeeding. और पल्लू दिया है कि आप क्राउड में भी बैठ के फीडिंग कर सकते हो
Oh
आसानी से.
my God. I think it's such a beautiful thought, Dr. Gangal. Such a beautiful thought.
So
Really.
that study was very favorable for breastfeeding or nursing in public also. Now you said forcing the mother. Why we should force the mothers? It is her baby. It is her wish. So our job is to prepare her antenatally, pre-delivery. So we are also, our organization BPNI Maharashtra, which I represent, has
Yes.
made a very nice app called Shishu Poshan app. It is
Okay.
available on Play Store, and it is three languages: Marathi, Hindi, and English. That will cover a lot of help, lot of mothers, even residents, nurses to get trained up. So antenatal leave, pre-delivery, at least 1 hour session on breastfeeding, where all these frequently asked questions, all doubts and difficulties are cleared up. And I'm very happy to say that more than 50 maternity homes, this particular pre-delivery counseling session is operated. And
Wow.
those frequently asked questions are there in that particular app. So preparing mother is very important. So that after birthing, the mother ask for the baby, give my baby to me, I want to feed my baby. And you'll
Right.
be surprised to know, just like a calf. Calf and cows are never trained for breastfeeding, right? But
Actually.
still, as soon as the calf is delivered, it stands on its feet and then it walks to the mother and the cow and starts feeding. Now, everybody asks me that a calf can do it. How can human beings do it? Okay, so human beings are intelligent. And as I said, why intelligent? So how the constituents, again, I would like to take you back to that IQ thing.
Mm-hmm.
The sugar, the called lactose, which contains galactose also, that is very important for brain building. That is highest in the human milk.
Okay.
And that galactose concentration is also related to brain size. So larger the brain size of any animal, larger the amount of galactose in the milk. Okay. So
Okay.
coming back to our topic, just like the calf walks to the cow for feeding, human babies of course can't do that. So it is our job to keep the baby in between the with head in between the two breasts and eyes at the level of nipple soon after delivery. Some people would do it even before the cord is cut and
Yes.
even before placenta is delivered. So just take the baby over there, and God has fitted a computer chip in baby's brain that baby knows the knowledge of the baby to breastfeed is more than that of the doctor, mother, or anybody else on this earth. So baby with the senses, what it has, a sensor adequately developed, and you will be surprised to know that the babies can go to the breast all by themselves and start breastfeeding within an hour. Okay, and 80% job is done by the smell.
Mm-hmm.
Rest is done by the eyes, the touch, and the heartbeat. The smell of chemical or in amniotic fluid is same as chemical on the nipple, so baby knows where to go. Why the breast, the areola is black and it becomes darkens during pregnancy? Because there
Mm-hmm.
is signal for baby your food is kept over there. And
Oh.
the heartbeats of the mother are heard by the baby. The mother's voice is recognized of the baby. And all that loving and warm environment, the with the baby getting exposed to mother's germs, not to the germs of the hospital or the baby walks to the breast and starts feeding. And we have made, though we have not invented it, we have made a special freely available video of breast crawl how baby
Okay.
crawls to the breast. So every pregnant mother and their family should see this video and demand that my baby also should be treated in the same way. So
Wonderful.
yeah, so that breast crawl video is available on, you type health phone breast crawl in Google and you will get that particular video. So everybody must see that video. All mothers should see that video. And it is the duty of every maternity service to help the mother initiate breastfeeding in that particular way. Now,
Ex-
your next question, that if one feed is given, what happens? As I told you, the challenge of the baby is to withstand the infections. So
Right.
even one feed can introduce infection and cause serious infection in the baby. Number one. Number two, that one feed you give but the baby's stomach is full. Uh, Animal milk takes a longer time for digestion. So the next 3 hours that baby is not going to feed on the mother.
Yes.
That one outside milk, the animal milk or the powder milk, may introduce a lot of allergies into the baby.
Okay.
So even one feed can be dangerous,
Oh,
and mother can calibrate her milk supply or increase her milk supply by continuous suckling. That's why God has told the baby, don't sleep for 3 days. Keep on opening mother's channels, and that milk output can increase only up to day 11. So you are delaying the process of milk coming in. You said that the milk is less I'll come to the milk less, but before that, I would like to say that the joke. The animals है, quite a few times their babies are lying in the mud.
yes.
ये सुअर
Yeah.
के बच्चे मड में ही पड़े रहते हैं, but still they don't get infected. Why? Because all the bacteria in their environment, mother, whether it's cow or any animal, they lick their babies. You must have seen that.
Yes, yes,
So while
yes,
licking
yes.
the babies, they pick up the germs in their environment,
Uh-huh.
and as it goes into her gut, there the white blood cells pick up those
My
particular
God.
bacteria. They migrate to the breast, and the antibodies are secreted in the milk. So
Wow.
cow licking the calf has a big science inside it. So I tell the mothers, kiss your baby as much as you want.
Oh,
There is no
okay.
charge for that. Handle
Oh,
your baby, touch your baby. So mother makes the antibodies against all the germs. So
wow.
we come back again for the quantity of milk. The
Yeah.
milk is less in the first few days because the baby's stomach capacity is less. The baby cannot accommodate anything more than, let's say, 3 kg baby, just 5 to 7 ml. Then,
Right.
as the baby's stomach capacity increases, the milk output increases,
Right.
and by day 15, it reaches somewhere around 800 ml. Abhi mothers get worried about less milk, even doctors and nurses get worried about breast milk. So, first thing, the mistake that any doctor or nurse can make is walk to the mother and press the way, अरे दूध आ रहा है कि नहीं?
Ah, we do that all the while.
And that causes a lot of negative influence on the mother. Even though
Right.
the milk is less, where it will come after pressing on day 1 or day 2. So, mother is convinced she has no milk.
Oh God.
Secondly, baby cries not because the baby is hungry, but baby because it's trying to dock to the mother. We have seen the rocket which is sent in from here and a capsule which is sent from here docks with the space station, right?
Yes.
So baby has left one dock in the
Uh-huh.
stomach and from placenta, now he has to dock to the breast.
Oh
So the
my
docking
God.
process takes about 15 days. And in that particular process, if you give outside milk or mother doesn't give proper touch, the baby doesn't get docked. So if like that capsule doesn't get docked to the space station, then there are going to be problems, right? So similarly, baby doesn't dock properly on the breast,
Oh
then
my
it's going
God.
to cause problems. I will tell you a short story.
Uh-huh.
Long time back, grandmother was delivering her grandchild, and the grandchild asked them, why should I feed the baby? The grandmother was insisting that she feeds the baby. So she said that baby has stayed in the uterus for 9 months, right? So that uterus has become baby's mother. Now, once delivery occurs, the mother is very no anxious that where is my baby?
Mm-hmm.
Okay. Now, when you will put the baby to breast, the uterine mother will get the message that her baby has reached at a proper place.
Oh my God.
So now we know by science what like grandmother was telling 100 years back was right. When the baby feeds at the breast, there's a hormone called oxytocin which is secreted in the mother's blood, and that goes and tells the uterus that your baby has reached at a proper place.
Oh,
Now
how
you can
sweet.
relax, into bracket contract till the time next delivery. So that scientific message also extremely good. So that's why the mother should latch the baby first. Docking of the baby on the breast is very important. Milk is less, but that is for a reason. Okay, what I explained to the mothers is पहले दूसरे दिन गंगोत्री की गंगा,
अच्छा.
चौथे पांचवें दिन ऋषिकेश की गंगा, सातवें आठवें दिन हरिद्वार की गंगा, 10वें 11वें 12वें दिन वाराणसी की गंगा,
वाह.
और 15वें दिन गंगा सागर. तो दूध का प्रमाण आस्ते आस्ते बढ़ने वाला है, और ये बढ़ बढ़ के ही आपको पर लगाना है छाती पे बच्चे को। अभी सबसे सारा सवाल आता है, देखिए मत दूध आता है कि नहीं। अगर वो जरूरी था तो भगवान ने ब्रेस्ट ट्रांसपेरेंट बना दिए रहते थे, बट द ब्रेस्ट आर नॉट ट्रांसपेरेंट। It's not
Oh,
necessary for the mother to, she has to just latch the baby.
oh
Baby
my
wants to get
God.
dog. The baby is not crying because hungry. Because mother has not given adequate touch. Because too many relatives have spoiled her mood. So there are so many things which disturb the baby.
Wow.
Medicalization of breastfeeding, that is what we say. So why the baby outside milk? Why the parents would demand outside milk? Once the baby cries, right?
Correct.
If the baby
When
cries,
the baby is hungry, so the baby is
hungry.
crying.
Yeah. So second thing is, so we shouldn't be allowing the baby to cry. What I
Okay.
tell the mother, रोने को चांस ही मत दे दो। मुंह खोला छाती मुंह में, मुंह खोला छाती मुंह में।
Mm.
Secondly, the gynecologists and obstetricians and pediatricians working are worried about sugar, baby sugars getting down. I'll come
Yes,
to that
yes.
particular
We
topic.
keep checking
Yeah.
their blood sugar levels.
So, so मैंने डब्बे की बात की थी कि there is the God has already given tiffin to the baby.
हाँ.
Okay. Now, the calories which the initial breast milk or colostrum contains are not good enough to take care of baby's hunger or take care of baby's caloric needs. They can satisfy the hunger because they fill up the stomach at whatever day and whatever size, but
Yes,
they are not enough to supply enough calories to the baby. So, where
right,
do extra calories come from? Extra calories come from that tiffin, which is there in the liver, storage of glucose, which is there. But a
right.
very crucial thing for that tiffin to release sugar into the blood is
Mm-hmm.
that the mother has to frequently feed the baby in first 15 days. It is not demand feeding in first 15 days, which most of the people, बच्चा उठेगा तभी पिलाओ। फिर वो
Mm-hmm.
5 बार उठेगा 24 घंटे में, तो 24 आवर्स में 5 times या 6 times या 7 times, but that is not the truth. The truth is that babies have to be fed frequently. And how many times? 10 times in 24 hours. Now,
Right.
why human babies need to do that? Because human being invented clothes. So babies don't get touched. The babies who are
Oh,
kept in touch, they remain alert, they remain active, they remain warm, so they wake up very frequently and feed. So
uh-huh.
Adivasi is keeping the bachchus inside. That baby
Uh-huh.
doesn't have to be told you have to feed. That baby wakes
Oh,
up frequently and feeds. But because the human beings tie the babies, the babies
right.
keep on feeling I'm still in the womb, I'm supposed to sleep. So babies
Oh,
then become extremely hungry and they wake up and then they start crying.
oh
And a
my
crying
God.
baby will never catch the breast. So maintaining frequency of feeding at least 10 times in 24 hours in first days, 15 days important. And after 15 days also it is at least 8 times. But the very high frequency, मैं mothers को बोलता हूँ 10 बार पिलाओ जरूरी है, 15 बार पिलाओ अच्छा है, 20 बार पिलाओ 25 बहुत अच्छा है, एट
Wow.
24 टाइम्स पिलाओ फर्स्ट क्लास एकदम। बच्चा अंदर पेट में तो बार बार माँ से ले रहा है शुगर। अभी मैं 24 कप में घंटे में 24 कप चाय पीने की आदत है, आप सडनली बोलो मुझे कि भाई 4-5 कप पियो 8 कप पियो, तो नहीं चलने वाला है।
Wow,
सो
wow.
मदर्स हैव टू कीप ऑन फीडिंग द बेबी frequently, not demand feeding first 15 days. The second complaint mothers would say that the baby doesn't wake up. You want me to feed every 1.5, 2 hourly, baby doesn't wake up. So there are tricks to awaken the baby gradually. Remove the blankets, remove the clothes, remove loin cloth. I'm purposely not saying diaper. I don't support
Oh,
diapers. Yeah, and then keep the baby in skin to skin touch and gradually massage or caress or touch therapy to the baby's back, baby's limbs, and baby would wake up beautifully. जागो मोहन प्यारे,
hi,
जैसे
hi.
गुलाब की कली खिलती है,
Wow,
प्यार से खिलती है, वैसे बच्चे की नींद भी प्यार से खुलेगी, तो वो प्यार से दूध पिएगा,
wow,
रोएगा नहीं।
wow.
वापस रख दिया बच्चे को, 1-1.5 घंटा हो गया, वापस ओपन करो, टच दे दो, फीडिंग के लिए प्रवृत्त करो उसको। सो दिस बेबीज वोंट क्राई, दे विल गेट इनफ कैलोरीज, दे विल गेट इनफ न्यूट्रिशन, एंड they will get enough. There are chemicals in the breast milk which increase baby's blood sugar. And
Oh,
science tells us now, this is especially for pediatricians, neonatal and obstetricians, the sugar levels in blood are directly proportional to frequency of feeding. So ज़्यादा frequency हो तो शुगर लेवल बढ़ जाती है,
right.
बिकॉज वो स्टॉक्स में से आती है ब्लड में। एंड बिलिरुबिन लेवल, जॉन्डिस के जो डरते हैं हम लोग इतना, तो
जी,
जॉन्डिस की लेवल इज इनवर्सली प्रोपोर्शनल टू फ्रीक्वेंसी ऑफ फीडिंग। So
okay.
every mother, every nurse, every obstetrician, every child specialist should know how to wake up a sleepy baby. And
Wow.
sometimes the babies would wake up by themselves, and even before crying, so रोने के बाद ही पिलाने का, that's a wrong concept. Baby tells in multiple different ways that how to, I'm hungry. I'm specially taking Hindi, so many mothers also in there.
True.
चुलबुल करना,
जी,
चुलबुल करना, इसको हम लोग सूक्ष्म प्रतिक्रियाएं बोलते हैं या अर्ली फीडिंग क्यूज बोलते हैं। चुलबुल करना, फिर
Right.
बच्चा उठने के बाद आँख खोल के देखता है, मुझे माँ तो मेरी कहीं दिख नहीं रही है, काला भाग तो दिख नहीं रहा है जहाँ में मेरा फूड मिल जाएगा मुझे।
Hmm.
फिर baby may make some small cooing sound, that the way we see in the Discovery Channel how the animal babies make noise. So they try to catch mother's attention. Then they'll open their mouth and try to look when he feeds her their heart. This is called rooting behavior. Or they will smack their lip to see if the mother has looks at them. Still the
Oh,
mother doesn't look, then they will put the thumb or finger in their mouth. But these things are ignored. The people wait for babies to cry up. And then the baby cries, he won't hold the breast. And one
oh,
of the most dangerous reaction is to go into more sleep. So if every mother knows how to wake up a sleepy baby, every mother knows that first 15 days at least 10 times more the better. And then how to baby shows that I'm hungry. Don't wait till the baby cries. Okay. And keep baby free while feeding. So these are the things you know.
wow,
Then
wow,
the
wow.
babies won't be crying.
I
Babies
think
won't be going into hypoglycemia.
we are trying to pamper our girls so much. We say, oh, now you're so tired after the delivery, you're so tired after the C-section, you've been in labor for so long, now you sleep and we will look after your baby. I think that is a tremendously wrong concept. The
Who
mother
says that
has,
mother will be relaxed without her baby? Mother will be more relaxed while she feeds the baby and she gives skin to skin touch to the baby because 18 hormones get secreted in mother's and baby's body with that
beautiful.
skin to skin touch. So it
And
is
I
wrong
think
to say that
the
mothers
mother,
will be happy to be left
postpartum
alone.
depression will also decrease, I'm sure,
Yes,
because
sure.
nowadays there is so much talk about postpartum depression, and I think this is a beautifully put forward point, sir. Really, really, I think our mothers are going to be extremely happy listening to this podcast, and so are our obstetricians. So, sir, going through your biodata, we see that you have trained not only students and lactation consultants, and the BPNI Maharashtra is doing such a great job regarding all this, but you have trained Malish Wali Bais also. So, I mean, I, I don't know, like, Malish Wali Bais, should we really be telling them because they give so many wrong inputs sometimes, I think. So, how did you go across this entire process of training Malish Wali Bais? And do you think that was of use? Like, what was the
It
result?
was extremely useful because what we found in the initial days was that taking a pre-delivery class for the mothers, helping mothers to feed during hospital admission stay. But once they go home, they are at the mercy of the Malishwali Maushi, who will may tell them right things, who may tell them wrong things, may support, may not support.
Right.
And we found they were telling many wrong things. So we started telling them, don't keep any Malishwali by. But that never worked. Rather than eliminating a system, it might be great to improving that system. So then we met a few Malishwali boys and we decided that we use them. They are going to home every day for 1.5 to 2 hours. So why not train them with some good messages about breastfeeding, about food, and some wrong things which they were doing, right? Cleaning baby's mouth with finger, which
Yes,
can cause
yes, yes.
diarrhea and infection in the baby.
Uh,
Removing babies from milk from baby's breast because
yes.
babies, whether male or female, get witch's milk, what they call milk. So
Correct,
expressing
correct.
that milk from the breast can cause infection and breast abscesses in the baby, or putting oil in baby's nose, which can cause oil pneumonia, or putting oil in baby's ears. So we took a 12-hour class for them every week, once a week, 1 hour for 12 weeks. And they were hugely interested. We trained something like 500 Malaysian Maushis from Northwest Mumbai, and they were extremely happy. We paid them some traveling allowance and some DA also, and we made them give the exam. We invented a small curriculum book, which a childcare book, and we give them cards, identity cards, and certificates also. So they were extremely happy. The mothers were extremely happy, and it was a win-win situation for everybody. So that
Wow.
particular thing really worked very well. One
Wow.
more thing I would like to say that after discharge, it is very important to monitor baby's weight because all babies lose weight by day 3 or 4, about 7 to 8%. And
Right.
then as the milk flow increases, they start passing more and more urine. Again, first 3 to 4 days, baby may pass urine only once in 24 hours, and that's
Right.
normal. And
Right.
many doctors and nurses get scared, Arey, ek hi baar pishab kiya. Because standard training is that baby is getting adequate feeds. Baby should
Mm.
pass urine at least 6 to 7 times. But that is after 15 days. Before
Right.
15 days, first thing only once in 24 hours is enough. And after that, urine output starts increasing, the baby starts putting on weight. And day 7, the weight should be taken. And that weight should be above day 3 weight, but it will be less than birth weight. And by day 14, all babies should cross their birth weight and go above. So this is a very important public health message. Babies have to be weighed on good weight, digital weighing scale 0, 3, 7, 14, and 28. Any baby who continues to lose weight by day 7, or loses more than 10% of the weight, or they don't gain birth weight, or they are not likely to gain birth weight by day 14, they need more attention. They need to check their breastfeeding, how they are feeding the babies, and whether they have any illnesses or not. And then subsequently, the weight has to be monitored on growth chart. World Health Organization has really come out with great growth charts. So whether baby is getting enough milk adequately, you can plot on growth charts, and you'll be surprised to know the
Hmm.
weight goes like a train, as if the train is following the railway tracks. So
Weight
baby's
tracks.
weight chart follows the WHO growth chart lines. So parents are convinced and doctor is convinced that the baby is getting enough. And this charting has to continue beyond 6 months also with appropriate food.
Awesome, sir. Awesome. I think that is another very, very, very nice message that has been given, because yes, mothers do worry whether they are feeding less, and the initial weight loss can make them feel very scared about it. But we have to be able to convince them that this is the normal standard thing that happens. And I'm sure that the only thing that happens, sir, is that once we deliver the baby, then the baby goes to the pediatrician straight away. And after that, very often, just one checkup after 8 days, and then we as obstetricians are no longer in the loop regarding this. So,
So
do
you have to be in the loop. All the matter, you have to be in the loop till the baby crosses the birth weight and goes on the green path. So
wow.
all maternity homes should track their babies actually.
Wow, wow. I think that is a very, very another good take-home message, and we shall make sure that we, follow the babies from our side also. More the number of eyes looking after the baby, I think the outcome will be better. And
Yes.
of course, our pediatricians do a great job, but it will not hurt if the obstetrician also stays in the loop. So again, another very
One more
important.
new concept which you must know, and every obstetrician should know, that we have got the mothers to the hospital and labor room. So from their home environment, cozy home environment, to a foreign environment of the labor room,
Right.
and not mothers were delivering in sitting position. Now we
Mhm.
have made them lie down because of interventions may be required. Not only we have tied them up quite a few times, the legs are put up in stirrups, and quite a few times unknown people walk into the labor room. So it is very important for us that we have got the mother from home to the hospital. So we need to make the labor room environment loving. So we thought that a name labor room also should be made.
Mhm.
Whether a citizen of our country comes for the first time, it should be called Navjat Shishu Agaman Kaksha,
Wow.
where the environment should be such that शहनाई के सुर बज रहे हैं,
हाँ, हाँ,
कोई
हाँ,
प्यार से
हाँ।
अंदर बुलाता है, कोई
ओ
सीलिंग
हो।
के ऊपर बहुत अच्छे बच्चों के फोटोग्राफ्स, लविंग फोटोग्राफ, some stories from mythology are put up over there, and everybody is helping the mother, talking to her very lovingly, and like her dadi, nani, and masis, and making the mother comfortable. Now also, even if I go attending the delivery, I strike a, well, the gynecologist obstetricians are busy, nurses are busy delivering. I strike a conversation with the mother. Quite a few times, mother lies on the delivery table with the hair left open. They feel that delivery faster if the hair are left open, but they come
Oh,
on the face, mother sweat, so they don't feel comfortable. So first thing I tell the nurse is that कंघी लेके आओ उनके राज और एक बाल यहाँ पे बांध दो ऊपर, so that they don't come in the way, they don't come on face also. Second thing I tell them is that get some napkin from the relatives, and depending on the season, either put it in soak it in cold water or warm water, and wipe mother's face. Just like we walk into the plane, we get given a
oh,
wipe to,
what a lovely concept.
yeah,
Lovely.
and that makes the mother very comfortable. You strike a conversation with her, and try to relax her, try to make her comfortable.
Right.
And the first thing that a baby looks after delivering is that the we also see mother's face. How
Yes.
beautiful is my mother? So when I conduct
Yes.
antenatal class, I ask the mother, tell the mother, say, all of you are looking very beautiful now. But would you look the same on delivery table when the baby wants to look at you? So I know that these labor pains are great, and it's not easy to bear them. But then, in spite of that, both mother and maternity have to see to it that she stays comfortable, and her so that her oxytocin is high.
Yes.
Normally, oxytocin is put in the glucose outside, but the internal oxytocin is very strong.
Oh,
More comfortable, easier the delivery because higher the oxytocin, and higher the
okay.
oxytocin, more comfortable the breastfeeding. So that changed environment concept of labor room, we no more want to call labor room as labor room. We'll call it Navjat Shishu Agaman Kaksha.
Mm.
And many hospitals, the civil hospitals now have changed that name and they're calling it Navjat Shishu Agaman Kaksha.
Ah, it's beautiful. Labor sounds like so laborious. So
Yes.
I think, it is like a torture room, it sounds like unnecessarily. I think this Navjat Shishu Agaman Kaksha is a beautiful name. And I'm sure after listening to this podcast, most people and gynecologists will change the name
In
of their.
fact, Fogsi should keep a competition to see which is the best Navjat Shishu Agaman Kaksha in the town.
Now, what we can do is that yes, now the World Breastfeeding Week is just
Nearing.
nearing. So I think we shall keep that competitions.
Competition.
I'll take it
Not
up.
just the structure and design, but how staff is lovingly helping the mothers. चुपके
Yes,
से जाओ
yes.
और देख के आ जाओ कैसे माँ को
Very
मदद कर रहे हो वो
beautiful,
लोग.
beautiful. I think we'll ask for videos, sir. We'll ask for some beautiful videos. Let us see. We'll try this at least this time, and maybe next time we'll have people going and
And you
visit.
asked me about Maleshwari Mausi. There is one more concept which I introduced called Hirkani room concept.
Oh yes, oh yes,
Yeah, now in many public places you will see Hirkani room which is taken. This
yes,
is
yes,
initiated by BPNI Maharashtra in help with the government. And we
yes.
are very proud to say that was one of our very successful concept. And we have more than 1,000 Hirkani rooms in Maharashtra now, whether in
Wow.
public place or in hospitals or whether at job. Yeah,
Yes,
so because mothers cannot carry their children to job, even if they have a crèche, they can't carry it. But if they are provided with a room where they can express their milk, mother's express milk stays out good for about 4 to 6 hours, depending on season. Will stay good in chiller
yes,
compartment for 24 hours. So mothers can express their milk at work and carry it home to be fed next day or at night. So that Hirkani room concept everybody has to know. And there are more than 1,000 Hirkani rooms which are there all over. In fact, when they how this name Hirkani room was given, that all of us know the story of Hirkani, right? Which
yes,
was 300 years back at the time of great Shivaji Maharaj,
yes, yes.
that she was there and she climbed Raigad at night.
True.
So, through WABA and Lal Ashi League, which Lal Ashi, the American Mother Support Group, they
Acha.
wanted to publish a book of working mothers
Yes.
and how working mothers, in spite of being at different positions, they could breastfeed their babies as per the recommendation. माओं
Acha.
को मैं हमेशा बोलता हूँ आप बच्चों को छोड़ के जाते हो, वो एक पनिशमेंट है, वो टाल नहीं जा सकती है. लेकिन आप ब्रेस्ट फीडिंग भी बंद करो, ये सेकंड पनिशमेंट विच इज अवॉइडेबल.
Okay.
So the mothers had stated their experiences, and incidentally, along with 2 or 3 other mothers, had also sent a story of Hirkani, and they liked it so much. They said that this is going to become our love, lead story. And then
Wow.
we photographed Raigad, Hirkani, Cliff, and Buruj, and that became the cover page of the book. So that
So,
world has gone world over, and that book
wow.
was called as Hirkani's Daughters. It is available on
Oh
Amazon.
my
So any
God.
working mother can read
Yes.
that book and they get
Yes.
inspiration how other mothers at different positions,
Wow.
small or big, have continued to feed their babies.
What an inspiring talk with you, sir. I mean, genuinely, like your every word is a pearl of wisdom. And I think that we just probably have time for one more question, sir. And this is about the baby friendly hospital initiative. Like every obstetrician wants to have a baby friendly hospital, but we really feel sometimes that there are a number of hurdles to this. So what do you think should be the first change that we should get across so that our hospital becomes baby friendly?
Where there is a will, there is a way. It's not a rocket science. There are very three most important things which every obstetrician can do, and with some help from BPNI Maharashtra lactation consultants, this is possible. The first thing is to start a proper pre-delivery counseling for the mothers in the early third trimester, that is sixth or seventh month, and
Okay.
1 hour dedicated for breastfeeding. The pattern of how to take it is already given in Shishu Poshan app as frequently asked questions with the interactive session. Then the first stage, so mothers are ready for birthing and the breastfeeding. Then other 1 hour can be for nutrition and different types of deliveries, etc., etc. Second thing, they have to start in normal deliveries. They have to start breastfeeding by breast crawl and initiation within 1 hour, which is fairly easy and which they will enjoy. The mothers will enjoy, and they will be a good start to breastfeeding. Even in cesarean section, many hospitals have cesarean rate as good as 50% or more. So in OT, the breastfeeding can be initiated, baby coming in the different directions from above, where anesthetists might be of great help
True,
and
true.
nurses will be of great help. So initiation can be even done in operation theatre. And third thing, exclusive breastfeeding, understanding all the principles which you have discussed, how to wake up a sleepy baby and frequency of feeding, with nurses trained up in that particular thing. The exclusive breastfeeding rate, whether cesarean or normal, can be pushed above 80%. These
Okay.
are the three main messages I would give to obstetrician. And in addition to that, for pediatricians, beyond 6 months when the food is started, we have the concept of four-dimensional immunization clinic.
Yes.
First D is diet and growth chart. Go do diet audit, monitor growth charts, and connect both. If the growth chart has gone abnormally, why it has gone up? If it has gone low, why it has gone down, and you will be helping the child greatly. Second is development. At every vaccination point, when the mother is little easy to understand what is going on, not while during illnesses. Every vaccine, there are some development questions to be asked about child turning over, holding the head, sitting by itself, walking. So that development also has to be passed. So if we pick up mentally retarded bachus, autistic bachus very early, and then third D is about drugs, calcium iron to the mother. If it is low
Yes.
birth weight baby, calcium and iron to the baby, and contraceptive advice to the mother, and incidental illnesses. And last D is dose. I am of the opinion that if any nurse or doctor is going to the last D, that is immunization, without addressing the first three Ds, then it's a crime of first order because you are neglecting that baby. So, BFHI and 4D immunization clinic are the hallmarks of the improvement of infant and young child feeding in our country. If you implement these two concepts properly, along with Shishu Poshan app, Breast Crawl, Navjat Shishu Agaman Kaksha, Hirkani's room, it will be, and Malishwali Maush is supporting. We'll have a completely breastfeeding society and
Wow.
with Hirkani's rooms everywhere.
Wow, 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 sir. A big round of applause. I really cannot stop clapping. And I think, as I said, every word that you spoke today has got so much of power, so much of knowledge, and so much of nourishment to the minds and brains of the obstetrician, as well as to the young women who are listening to this entire podcast. And I think that's something we say that breast milk is amrut. We all want to give the best things to our baby. We want to make sure that they do well, they study well, we want to give them property, money. But I think health is something that is so much more important. Health is wealth, we all know. And the best health we can give our baby can be through this exclusive breastfeeding, which is
Nutrition,
such a,
health and nutrition both. Health,
yes,
nutrition and care.
absolutely, which is such a beautiful process. And the bond between the mother and the child, which will develop through this particular process of breastfeeding, is going to go a long way. And both the baby as well as the mother are going to stay happy and healthy because of this.
I must be telling you that we have also developed a mother support group in Mumbai and Pune. So
Okay,
these mother support leaders go to various maternity homes, small and big, as well as they go for home visits also. So I'm proud to say in Mumbai we have facility. If the mother wants feeding, breastfeeding help even at home. Of course, they will charge some amount, whatever their fees are. But that service is available now. So any mother with a breastfeeding problem can go to bpnimaharashtra.org website, and there are different places who is available with their phone numbers is available. A beautiful website, bpnimaharashtra.org. So mothers have help, and with the help of charitable organizations in where the honorarium comes from either UNICEF initially and now Aarti Foundation and sometimes BPNI Maharashtra. We are covering up municipal hospitals also. And we
okay,
are covering about one-fourth population of Mumbai through this particular initiative, and maybe little less in Pune. So that
wow.
mother support group leaders, lactation concern counselors are the innovative services which are available. We train for smallest degree also and international accreditation also. So anybody wants help in this particular topic can call us and we'll be ready to provide help to them.
That is so well said, sir. I think the amount of work that you've done for society through this particular process of helping women to breastfeed exclusively, it is the सगळ्यात पुण्याचं काम केलं आहे, sir, तुम्ही. I
Not just us, we have with support for us Maharashtra government and seven other states where we are working and the UNICEF office of these places
yes.
and our maternity homes which have been of great support to us where we have carried out our experiments of how to do better.
Absolutely. So, with that, sir, we come to the end of this fantastic podcast. And we would really like to stay in touch with you. And we would like to expand on this topic of breastfeeding. And of course, you're always there for all our conferences and our workshops. And we really wish to spread this message of, Stanapan, Amrutpan, which is such a beautiful thing to do.
And thanking Gyan Pravah, Tandulwadkar madam, and you and Foxy for allowing me and giving me chance to be a part of this podcast.
Thank you once again. Thank you, support team, for the entire support.
Thank you,
Thank you very
support.
much.
Yes, thank you.
Are we off air?